We bought the RxMedic counting system in January of 2010. We had decided to buy some sort of automation during that time, and we looked around at different options and decided on that and bought it. We fill about 500 prescriptions here a day on an average, and it's a pretty busy, small independent pharmacy in rural West Virginia. At the time we considered automation here at Hurley Drug, we looked at many different automation systems. We looked at robots and we looked at the ACS. Our decision was based on, one was space, and then the other was cost. And I really think that we really got something good for our money, because we had limited space. We would have had to spend a lot of money on remodeling to make one of the robots that cost a whole lot more to work. During busy times, it helps because sometimes out of 10 prescriptions one patient may have, it may count 6 or 7 of those, and they're ready by the time it gets to the filling part of the pharmacy. So that's a very good advantage, and it helps our staff not having to go find the drugs on the shelves. It's all right there, and we do it in the first phase of the filling, and then pull the other drugs as it goes down. So it makes it much more efficient. It has allowed our pharmacists to have time to do the MTM counseling and to do other things that the pharmacist needs to do, not just be involved in the dispensing of the medications. We have had great support from RxMedic. We couldn't really ask for any better. Anytime we've had problems, they've been really bent over backwards to help us. It has a lot of safety features as far as making sure the right drug is in the right bin, making sure you see the picture, so when you dispense the medication you can see the picture, making sure you have the right medication. And there's a lot of safeguards put into the system to help prevent errors. The maintenance requirements with the ACS machine have been really minimal. Cleaning of it is simple. NDC numbers, changing the drugs, the bins, it's really an easy process. That was one thing when we looked at the machine. Some of them you had to send it in and to change the NDC number, and as we know, we don't like to change the generic drug that we get, but it happens all the time. I think the maintenance requirements are very low with this machine. If I were talking to another pharmacist about the ACS machine, I would definitely recommend it. I think it's been an added asset for our productivity and the efficiency of the pharmacy, especially in the times we're in now with all the uncertainty. I think that it does give you the automation, and it gives you 46 drugs is pretty significant, and then it gives you all that option and without spending the amount of money that a lot of the robots cost. That it simultaneously counts, you can, 6, 7, however many prescriptions you need, they're ready by the time you go to fill them. So I do think it's very efficient, and it really does help our productivity. So.